Relationship terms. We talked about anterior and posterior. Let's make sure you're okay with medial versus lateral and otherwise. So as we start to talk more about medial versus lateral, medial is anything that's going to be closer to midline. So we'll say that, the belly button is very medial, whereas the shoulder is kind of lateral. Or the hand is an even better example. The thumb in anatomic position is lateral, meaning that it is far away from this midline here. It's further out. Let me see here. So from midline, the further away you get, the more lateral you get. Now, proximal and distal, you'll say that the elbow, for example, is proximal. Let me get rid of these drawings. Okay, never mind. That the shoulder here is proximal to the elbow. The elbow would be proximal to the wrist and so on. The fingertips are the most distal you can get. But you can say, like, for example, if we're talking about the forearm here, if we are talking about the proximal forearm, what that would mean is this area of the forearm, the area closer to the point of attachment of the arm in general. Or if we were talking about the proximal humerus, so here's the humerus, the proximal humerus would be here, the distal humerus would be here. Same with like the femur and so on. All right, let's see. All right, so here, projection, we talked about that. A stands for anterior. That means if you are the X-ray, you enter the anterior side first, and then with the posterior here, you're exiting the posterior. And so it would reverse here. You're entering the posterior side of the body, exiting the anterior before you hit the board here. An oblique projection is, we're going to get into this with the hand and we'll talk about it more then, but oblique means that it's not flat. There's an angle to it. So each body part will have its own angle and positioning. So instead of laying the hand flat down or turning it into a lateral, like we saw with the chest, you're going to have it as an angle. So for example, the hand, we're going to try and get a 45-degree angle right here of the hand. Back to math class, right? This angle would be 45 degrees. The foot is a little bit less, but you can see it is rotated here. Lateral projections, we have seen those in chest so far. As we get further into positioning, you're going to see that sometimes it's a lateral medial or a medial lateral. And what that refers to again is this. So it's not one or the other for a chest or abdomen or anything like that. But when you get to these other body parts, that starts to apply. So again, the thumb is lateral, the pinky is medial. So if you are the X-ray and you are entering, let's say for your lateral, this side of the hand and exiting this side, then you have a medial lateral because you're entering the medial side, exiting the lateral. Supine and prone, this is going to be supine here. I usually remember the word up as in face up, and then prone here. I usually remember, sorry, this thing is in the way. There you go. On your front or something like that. However you would like to remember it. That usually helps me. Okay, we'll get into those a little bit later. And here's another oblique position. As you can see, like for a chest x-ray, for example, instead of being flat down, so that mid-coronal plane, right, is parallel with the board where you have, okay, there's the board, they're like this, the mid-coronal plane. They're not rotated. Now you actually want that rotation. So now you can see there's going to be, some rotation there, whereas the board is here. So all of a sudden you want that rotation there. Same with this one, angle here. So eventually those lines intersect. So no longer parallel. And decubitus is something we'll get into a little bit later. Decubitus means that the person is both laying down or recumbent, and there is a horizontal x-ray. A chest x-ray, for example, has a horizontal x-ray beam. So we have the bucky here for the chest, right? The person standing here. And the x-ray comes in like this. Well, that x-ray is horizontal to the ground, right? They're horizontal, or you could almost say parallel. um, parallel to the ground, or, it's along with the horizon. And that's the same thing here. You can see the x-ray coming in here. It is not pointed down like you would, for example, for a KUB. But instead of getting a lateral view, you're getting a decubitus view. So the projection on this, believe it or not, would be an AP. Because this x-ray is coming in, it's entering the anterior side of the body, exiting posterior before it hits the IR here. And this would be our PA. This would be a decubitus because the patient is laying down and you have a horizontal x-ray beam again. It's like with the horizon parallel to the floor. Only this time the patient is laying so that you're getting a lateral. Um, so that's possible as well. And I think we'll end this there.